Limitless physical therapy specialist.
Hi guys, I'm Brooke.
We're going to be talking today about how kind of a healthy spine moves in all directions. So this is to kind of go along with our email that's coming today too. We're going to go through a couple of movements that are really typical things we do in the office with our patients, and it's just nothing more than getting your spine to move in its normal range of motion. So if you're feeling okay, or maybe you're feeling a little stiff, these would be okay exercises for you to try. So Brooke's going to kind of demo some of them, and I'll talk through them as we go. So why don't you go ahead and start up on kind of hands and knees position. So sometimes your back might not want to go into a rounded position, but Brooke's going to just show a safe way to try that out. So go ahead and rock back, Brooke, lay right down into that position. You can see her low back gets nice and round in that position, and this might feel like a really good stretch for your low back, your hips, and your knees. You kind of come on back up and just show that maybe 2 more times so people can get an idea of what we're talking about. And that's perfect. You might do this, actually you might do any of these exercises, and right off the bat, the first 1 or 2 might feel stiff, but maybe as you kind of ease into that new range of motion, it loosens up for you and starts to feel better. So go ahead and lay on your side, kind of facing that way for me. The next one we're going to try is just a little bit of rotation through your low back and upper back. So Brooke's going to start here, and then she's going to just bring her arm up and over so she feels a nice twist through her low back and her upper back. Come on back over. This is a really great exercise for anyone who does any kind of sports, especially anything like golf or tennis, where you might have some natural twisting in your back. And again, this one usually loosens up for people as they go. Come on over on your backside for me, Brooke. And the next one here is another way to kind of rotate a little more focused on your low back or your lumbar spine. So Brooke's just going to cross one foot over her knee and let her hips fall all the way to one side and then all the way back over to the other side. And again, that kind of emphasizes the low back a little bit more than the upper back, and it's a really safe way to start with some rotation, range of motion. So come over on your belly for me, Brooke. Again, sometimes people get sensitive with an extension of their spine, but Brooke's going to just start on her elbows a little bit and do a little bit of a baby kind of extension there in her low back. And in this position, she can just relax and kind of breathe there. And if that feels okay, if it feels like your back wants to give it to you, you can go ahead and press up through your hands and get that full extension through your low back. And then you can repeat that back and forth. Any of these could be done in sets of maybe 5 even to 15 repetitions 2 or 3 times a day, especially if your back's feeling a little bit stiff. The key kind of takeaway for these is that you're just going to take what your back is willing to give in any given day. I'm going to show one more exercise. Brooke, go ahead and stand right up for me, and you can kind of face me. So another one that can feel really good if your back's feeling a little bit tight is just a forward flexion. So Brooke's going to just kind of roll down, and you can see her whole spine right from the top down. She starts to get a nice round out in her upper back all the way down to her low back, and then she's going to kind of do the reverse and roll herself right back up. So kind of the key takeaways from this are that a healthy spine moves in all directions, and also that as you do these exercises, just kind of test the water, see how they feel, and then as you can, you'll get a little bit more range of motion as you work through the sets and repetitions. Have a great day.